All right. Well, welcome everybody. I'm Jeremiah Vardaman with the University of Wyoming Extension, and this is our Barnyards and Backyards live show. So really glad to have you. Today we got a great topic and we got a really good presenter in. And so we're really excited. Dr. Carl Hoops, how are you doing this evening?
I'm doing well.
Doing good. Thanks for coming and joining us. Dr. Hoops is a licensed veterinarian. He's the equine specialist for Utah State University. We're really grateful to have him come in and talk on this great topic of equine dentistry. And then we're also going to talk a little bit about internal parasites and control of those at the end of the show. So we got a lot of good things. But on top of that, Dr. Hoops is also a licensed equine dentist. And I probably said that wrong. And then also on top, we were just chatting before the show, he's also a farrier. So he's the guy. Everybody, just for everybody's knowledge too, and I think you have it in your introduction, but I'm going to steal a little bit of your thunder, but he also does race horses on the side just because he's crazy and loves to have fun. Beyond that, he's just a down-to-earth good guy, and we're really glad to have you here tonight. Before we jump into your presentation though, let's get a little bit of some housekeeping out of the way. Really grateful everybody's joining us. If you have a question, so if you've never been in one of these webinars before, down at the bottom of the screen, if you roll your mouse across there, there's a Q&A button and a chat button. Bring your questions forward through those two mechanisms. You'll have to type them in Q&A and chat. I'll be watching those. Another person I haven't highlighted yet is Jenny Thompson. She's behind the Barnyards and Backyards logo. You won't see her, but you possibly may hear her throughout the show. She's going to be watching Facebook Live. And Jenny is one of our specialists down on campus, and she gets all the background working and keeps us on task and makes sure the show runs smoothly. She's watching Facebook Live. So if you got questions there, put those in the comments box. She's watching Facebook Live, and we'll bring those into the show as well. Beyond that, that's all I have to get us started. So let's jump over to your presentation then, Dr. Hoops.
Sounds good. I'll get it brought up here on the screen. All right. Okay, well, thank you. Thank you, Jeremiah, for introducing me, and thank you for inviting me. I'm excited to be here for quite a few reasons. First of all, these are topics that I do have a lot of interest in and some specialty in as well. But other than that, I grew up in Wyoming. Wyoming is my home state. I grew up near Afton in a small little community called Fairview. It was a small dairy farm. My dad had about 80 cows, and we used horses every day. As you can see, this picture here is my grandpa, my dad, and it's a little dark to see, but there's a bunch of kids sitting on that sleigh too. And we used it to go feed cattle. Horses became our hobby as well. I participated in 4-H and FFA. And at that point as well, I got into horse racing. We had a little county fair there in Star Valley in Lincoln County. And we started chariot racing as well. And I continued to do that throughout my life. I went to the University of Wyoming for my Bachelor of Science. I graduated in 2000. And also I graduated from Colorado State University. I understand it's the dreaded state down south. My family disowned me almost, but Wyoming didn't have a vet school. And so it was something that I had to go out of state for. And by the way, we currently got approved for a 4-year vet school here at Utah State. And so
wow.
We are in the process of designing and building and going to a full 4-year vet school. So hopefully within the next 5 years or I think 2025 is the date they want to accept their first class. And so we got a lot of work to do. But anyway, yeah, my family forgave me for going to Colorado State University, and I made it back to the Intermountain West after that. Okay, so let's get into dentistry. Why do we do dentistry? What are we trying to accomplish as we're doing a dental or a float? Those are some of the common terms that we talk about. The term floating is a carpentry term. That is, they ran an instrument over a board to smooth it out so that things would either be smooth or glide over the top of each other. So anyway, that's the terminology that we use. What the goals are: we want to balance an arcade. We want to make sure that the teeth are even and level going across the grinding surface.
Hold on.
Go right ahead. Go right ahead.
You got me at the first go here.
Okay.
Arcade. Is that what you're meaning by the teeth, or what is arcade?
An arcade, we have 4 arcades, and they're divided into 4 different segments. The upper right arcade is referred to as number 1. Upper left is number 2. Lower left is number 3, and lower right is number 4. But the arcade is essentially that group or row of teeth that work together and provide a grinding surface. And so we have 4 different arcades, and we're talking mainly about the cheek teeth. We'll see here in just a moment that we've got incisors and canines in the front end, and we do work on them, but the grinding surface is primarily in those premolars and molars in the back.
Perfect. So we're trying to balance those 4 regions of the teeth, right? So we have the best to maximize the surface of our grinding capability.
Yep.
And I'm sure you're going to get to that, but that will tie into our nutrition a little bit.
It ties into it a lot, not just a little bit, a lot. Their ability to grind their food, their ability to break down that feed particle into a small particle allows them to digest it, and they get more out of it. If they're not able to grind their food, it stays in a large particle and they're not able to digest it. So it has a lot to do with nutrition and getting the nutritional value out of that feed.
That absorptive ability of the digestion
Yep.
to break that particle size down into units that are usable in our nutrition.
Exactly.
Right?
Yep.
Good. All right.
Yep.
I think we're good. Let's move on.
Okay. We also want to be able to identify and treat any disease processes, whether we've got a fractured tooth, a loose tooth, infection, or any other sores in the soft tissue around that area. We want to be able to identify them and then provide treatment to correct those problems. The other thing that we do with horses that are pretty important is it's to ensure performance capabilities. Horses have to be able, their teeth have to glide against each other as they lift their head up and down. And if they've got any sharp points or high spots or low spots, then in order to lift their head up and down, they have to open their mouth to be able to allow that movement up and down. So if we're in a competition, or if we've got a bit in this horse's mouth and they're fighting the bit, or they're just not doing well, you can look at their teeth to see if they've got high spots or low spots that are preventing that freedom of movement of the teeth there.
So is that what you would recommend to first start with? If you're having a horse that's kind of giving you some problems, throwing their head, fighting the bit, whatever you want to call that term, is that where you would start first? Is, hey, maybe it's just get them in with a dental exam to make sure things are right there before we go into anything too corrective.
Yeah, and that's one of the easy fixes. I mean, a dental is easy, it's quick, and it works really well. And I'm not saying that's always going to be the thing that works, but it is one of the things that can definitely help. There are a lot of trainers out there that will not accept a horse until they've been to the dentist, and that is taken care of, or so that they don't have to worry about it. A young horse, one that they're just starting, a lot of those trainers want them to go to the dentist so that they're not developing bad habits that can be due in part to the problems that they have within their teeth.
Well, and then you can also see in training or in a competition, if that behavioral problem is a physical problem like the teeth in the mouth or a pain, or if the horse is balking at something else that we need to address in a training manner, right?
Yep. And so this is one place you can start, and it's an easy fix. It's the other ones that aren't as quite as easy, the training that takes a lot of time and effort.
Right. Okay. So we want free movement of that jaw for all aspect of that horse's life. Even if they're out in the pasture, not being worked at this time, they're still going to be sensitive to that as they put their head down to eat, drink, a head up to run, whatever they're doing.
And their ability to grind the feed, to grind that forage into a, like we've talked about. Yep. Okay, but why do we need to do dentals? Horses have a tooth that's called a hypsodont tooth. And as you can see in this picture here, they have really long tooth roots that even extend up into their sinuses. Really amazing. And they continually erupt throughout the majority of that horse's life. And so as they're grinding those teeth down, and they wears the surface down, and eventually they actually do run out of tooth. And when it reaches the end of that life, it's about 20 to 25 years old. Their teeth won't automatically fall out, but they just stop growing. And so then there's not a lot of problems with them. Well, if there are problems, it's hard to correct because the tooth is not going to grow anymore. So we have to take that into account, that they're always going to grow.
And that's what I think that term long in the tooth comes from. Maybe not specifically horses, but animals that have similar teeth to horses. Is that they're long in the tooth. And once that tooth stops, that's it. You're done.
They do age horses quite a bit by their teeth. And so when they're talking about how he's a little long in the tooth, they mean he's old. That's, some of us are getting a little long in the tooth too, aren't we?
Right. So, more than we want to admit.
Exactly.
So you said those roots go all the way up into the sinus cavities on a horse. Is that ever a problem for abscess or infection up in that area?
It is. If you get a tooth root abscess, it can definitely become a sinus infection as well. And yes, they do cause a lot of problems. The other thing that happens is if we have a fractured or a broken tooth, oftentimes we have to go into the sinus to be able to surgically remove that tooth. And so there are some other things we wouldn't necessarily use a saw and cut a hole right there to be able to access those teeth up in those sinuses. So pretty crazy.
That is crazy.
The teeth in the horse are also offset, just like in our teeth. And if everybody can kind of feel their own teeth for a few minutes, the upper teeth are set to the outside. The lower teeth are set to the inside. And because they're offset, they're going to have specific wear patterns. And we'll talk more about those wear patterns here in just a little bit when I show some more diagrams. These horses have a different nerve system than we do, which makes we're able to grind on their teeth without having to numb them up. And we can take a certain amount off without causing any problems. Now, I'm not saying we can't cause problems, and we can if we go too far. But we're pretty fortunate that those horses have a different kind of a nerve system.
Well, and that wear pattern, right? Those teeth continually grow, and they are used to being worn down. And so with dental, and you'll get into it with the floating and all the tools, but to get that tooth to level out, it's somewhat comfortable for them to get them ground down to a normal plane.
And if you're correcting problems, they recognize that. They really do, and it frees up their mouth. So yes, it is somewhat normal for them. Okay. They can have abnormal wear patterns, though, if teeth are missing, because they're continually grinding against each other and wearing on a normal wear pattern. If all of a sudden one tooth is gone, there's nothing to wear against, that tooth will become really, really long and be required to be ground down on a regular basis to keep that freedom of movement. And then again,
so it needs that opposing tooth to help it maintain where it needs to be in that constant pressure and grind.
And that's what we mean by a balanced arcade, that we're trying to keep them level with each other so that they can have a smooth motion across as they're grinding.
Excellent.
We can also have quite a few diseases that we've talked about: abscesses, sores, broken teeth. All of those things will cause problems. And so we'll need to definitely be evaluating those things. When we look at a horse, what do we look at to say, oh, my horse has teeth problems, I need to take him to the veterinarian to get looked at? Obviously, weight loss is definitely part of it. Like we've talked about, they're not able to grind their feed. They're not getting the full nutritional value of their feed. And so they're actually underweight. That's what I've got a picture of here. A horse that is at a 2 or a 3 body condition score when we want them at a 4 or a 5 with a little bit more fat on them and stuff like that. We'll often see them dropping their feed. If they've got a sharp tooth, and they bite down and it hurts, then they let it out. It's going to hurt. They have a hard time grinding their grain, and a lot of times the grain just falls out of their mouth. Not always. There's other problems that can cause that, but that is just one thing we look at.
That's what we're, at least for me personally, with our horses, that's what we're always assessing when we give them a little bit of grain. If one of them's dribbling it out on the ground and can't keep it in their mouth, there's something going on there.
Yeah,
doesn't mean it's dental. That's usually where our first brain thinks of, at least here. So,
well, and that's one of the easier fixes. So
that's what we're hoping for.
Yep, yep. We will oftentimes see swelling on the side of their face. If they've got a sharp tooth, they will often use their tongue and put feed or hay up between that tooth and their cheek to act as kind of a Band-Aid to prevent that soreness or the rubbing that occurs. And so you can see a swelling on the side of their face. You may also have a foul smell. If there's an infection going on, it smells bad. Or if they're drooling. Oftentimes, even when they're losing a normal baby tooth, you'll see a lot of drooling because that tooth hurts. And it takes a little bit of time, and that drooling, well, the tooth falls out and everything's just fine. You got to be careful with those two, because there are some diseases that we have to be careful about that will cause a foul smell or drooling. And so be really careful with those and they're diseases that may communicate to people as well. I refer to maybe vesicular stomatitis or rabies. Those are symptoms that an affected horse can cause problems. And there again, go ahead.
I had a question on these signs. Is there a difference of these on age, or are they the same kind of across the range? As an example, is the swelling on the face or weight loss, do you see that more in a younger horse versus an older horse? Is it just kind of uniform no matter what age they are?
It's pretty uniform. A horse with dental problems at any age will be showing these kind of signs. Unfortunately, the older the horse gets, the geriatric horses that are above 20 years old, they need all of the nutrition they can get. And so it may affect them a little sooner than it would a younger horse or a horse that's 7 to 10 years old, just at maintenance. So activity level, age, all of that may change the signs a little bit, but all of them are affected across the board.
Gotcha.
And then we've also talked about fighting the bit there as one of the signs. So we've covered that one a little bit. Almost every dental I do, not almost every dental that I do requires sedation. And really that's for the safety of the horse, the comfort of the horse, as well as me as the veterinarian. It is much easier when they're not trying to fight. But currently the law states that has to be under the direction of a veterinarian. And I know here in Utah, we've had a lot of lay dentists is what we call them, but people that have gone out and received training for dentistry, but are not veterinarians, that would like to do this on their own. But currently the law states that a veterinarian has to be on the premises and oversees the sedation side of things. The lay dentist can be a technician that's doing the work on the teeth. And there's a lot of really good ones out there, but current law says that it needs to be under the direction of a veterinarian. And I've got a few different sedation drugs there that we could talk about that we normally use, but that's going to be up to the veterinarian to decide what he would like to use.
So that's mainly on the drug is what you're talking about there. It's just the sedation part of the horse. People that are a lay dentist, as you call them, they can do the dentistry work. They're good at it. They've been trained in it. They're certified, but just the sedation part with the drug needs to be through a licensed veterinarian.
And the way that the Utah law reads right now, and I'm not as familiar with Wyoming, but a veterinarian has to be on the premises while he's doing the dental work too.
Okay.
And the reason that is they're making a diagnosis and they're applying a treatment. And so
Gotcha.
that's currently under the Veterinary Practice Act.
Sure.
And that's pretty similar in most states.
Okay.
So,
But I don't know Wyoming that way, but no, I think it's worth, people need to look into that. Call your local vet, talk to them. They will be able to advise you on that. But that might be a reason why it's not a house call,
yeah.
right? It might be you need to bring the horse into the veterinary clinic. The vet can sedate it, and the technician or whoever's doing the dental work can do that then there.
Yep.
But they can't come to your location possibly.
I do, as a veterinarian, I do a lot of at-home dentals. And when it's more than one horse, it's a lot easier for me to come out than, and that's the other way as well. But we have to remember the licensed veterinarian is important there.
Yeah, depends on what that veterinary practice is, right? So call your local vet.
Yep. And visit with them, because and you got to remember as well, not all veterinarians are trained in dentistry. And it's important to find one that is trained in dentistry and has had that continuing education there, because in school, we don't have time to learn everything or time to practice everything. And so when we get out, that's the way we did it.
Well, and specializing, right?
Yeah.
So there's different types of vets. So yeah, talk to that veterinarian and find somebody that, I don't know if they necessarily need to be an equine specialist, but they do need to have that dental specialty to offer that service or feel comfortable at it.
Yep. And they, especially when they get into the use of the power tools that we'll show you here in just a few minutes. But those power tools can cause a lot of harm if they have not had the right training. So, okay, so when we get there, as a veterinarian, I'm going to evaluate the horse. I'm going to make sure that they're physically healthy enough to be sedated, and most horses really are. I'm going to look at the gums. I'm going to look at the incisors, and I'm going to look at those teeth before I use a speculum, so that I make sure it's safe to be able to use the equipment that I would like to use. I'm going to look at the overall health of the horse, look at their weight. Then I'm going to do a quick evaluation, look for their sores on their tongue, on their gums, look for bad breath, all those things that we talked about. But when I do my exam, I am going to put a speculum in that horse's mouth, and I am going to be able to look back there, because you really can't do a good dental exam unless you put that speculum in. I know a lot of guys will open the cheek up a little bit, pull the tongue off to the side, and try to look back in there. And I do that as well, and I'll often see some of those problems right up front. But to do a thorough exam, you've got to put a speculum in, open that horse's mouth out and up, and be able to look back in there, be able to feel back in there, and be able to evaluate all those teeth that are clear back in the back.
Well, and we haven't covered it, but a speculum is a device that goes inside the horse's mouth to hold it open. And we'll get to that. We'll show people that here in a little bit. I just want you to know that. But yeah, that speculum helps everybody.
Yes, it does. And safety. You should never reach in a horse's mouth because they can bite your finger off. They have a lot of strength there. They're grinding food all the time and a lot of muscle. So never put your fingers back in there where they can get bit. So even me as a professional, I will not reach back in a horse's mouth. I still have all my fingers. So it's all good.
Finger check, right? That's the veterinary code to get in the door.
Absolutely. I put up this slide to really show us the different arcades that we talked about, but also how many teeth a horse has. And if a horse has all of the teeth, that's 44. There's 11 on each side. As you can see, we kind of number 1 through 3 with the incisors. That canine tooth is number 4. The wolf tooth right here, this is generally the location of that wolf tooth, is number 5. And then 6, 7, 8, 9, 10, and 11 make up the arcade in the back. And so there's a lot of teeth in that little space. and they do a really good job grinding and keeping those things. To mention right quick, those wolf teeth. These are the teeth that are often removed from a horse. They're very, very small, very small tooth root, so they're easy to remove. They don't have a purpose back there grinding food or anything like that. And so the problem that can happen is if you put a bit in a horse's mouth and that bit is sitting right there and you bring the bit back into the cheek, the bit never touches that tooth, but the cheek will be brought back into that tooth. And because it's small and sharp, it can hurt. And so that's the reason those wolf teeth are often removed. Don't ever confuse it with the canine tooth. That can be a problem. Those canine teeth are not easy to remove. They can be very difficult.
You jumped the gun on me on that one. I was going to ask you specifically about the wolf tooth and that with the bit. You got me there. But just clarification, if I understand it correctly, that wolf tooth is way back there by the molars. You have to get that jaw open and the cheek kind of out of the way to even see that wolf tooth. A lot of people, like you said, confuse that canine tooth because they'll just kind of open the lips right there and see that tooth hanging there. That's the incisor. That's not the wolf tooth, correct?
That's the canine tooth right there.
Oh, sorry, canine.
Yep. Canine tooth.
Canine tooth.
And those are pretty big. Oftentimes we will grind them down, but definitely do not confuse that canine tooth or the bridle tooth. It's often referred to as a bridle tooth. Okay. Now, not all horses will have those. A lot of times your females will not have a canine tooth. Most all of your males will, geldings and stallions will, but don't be surprised if your mare does not have a canine tooth.
So now, does that canine tooth interfere with a bit or have problems with a bit where we have to remove it or grind on it?
Not often. That bit will sit behind the bridle tooth, behind that canine tooth. The problem is if they get really sharp or if they get pretty tall. And that's when I can grind them down and take that sharp surface off.
But that sharpness is more on the tongue and the cheek kind of issue, correct?
Yep. And very rarely do we have problems with canine teeth.
Awesome.
Okay. So yeah, that's a lot of teeth right there.
It's a lot.
It's a lot. And there again, I did show that we've got really long tooth root on all of them. If you look at the incisors up front, the canine, the only one that doesn't have much of a root is that wolf tooth.
And that wolf tooth can be, you can have one in the mouth or four or two, top, bottom, whatever.
I've seen four. The majority of horses will have just two, the upper.
Okay.
Very rarely will they have it on 3 and 4.
Gotcha.
But if they're, and not uncommon for them to have just one. And oftentimes when I'm looking at a 6-month-old foal, when I've laid them down for a castration, I always look. They won't always have them at that point in time, that it takes an adult before they're able to erupt and come on out.
Great.
Okay, so let's go through some of the tools, just so you're aware of what we've got. We've got speculums, power floats, hand floats, forceps, headstands. There's a lot of, and I'm not going to share everything, but I just want you to be aware of a few of the things that we're going to use. This is called a full mouth speculum. It's got the places right here for the upper incisors and the lower incisors that will then hold the mouth open. And they have all different kinds of ratchets that will hold them open. And they're very, very valuable. You have to be careful that you, like us, we go to the dentist, we don't want our mouth to be cranked on and held open for long periods of time. So you definitely give them rest during the process. But I use this full mouth speculum for my exams and for the actual doing the dentistry. There are a few others that can be used. Let me go back. Yeah, this is a picture of me doing a dental. This was a fun one. There was a dude ranch up in DuBois, Wyoming, and I would go up and do 65 head in a 2-day period of time. And I was very, very tired after the end of that.
That you were wore out and glad for power tools.
I was very glad. And then one year, my power tools burned out on me right in the middle of it. So I had to end up doing about 30 of them by hand. That was not fun. But fortunately, I'd been doing it for a couple of years at that point in time. And so there were really no surprises to me. And it was just routine maintenance at that time.
A little bit less labor then.
Yep. These next two speculums, I have a hard time with this one. I don't like to use it because it goes back and you put it in their cheek, and that they've got to bite down on that metal surface, and that can cause a few problems. So I don't ever use this kind of a speculum. I do like this wedge mouth speculum, and that's a piece of rubber that's going back in there. And so it's not as big of a problem. There again, I like the full mouth speculum, but I don't want to be causing any more problems than what I'm going in there to fix.
Just like our teeth. We don't like metal on our teeth. It's not good for them. Don't go to it. Yep.
Exactly. There are a lot of different power floats, and I really like the power floats. I think they're safer for the horse when the person that's using them has the right knowledge and has the right experience, because this is a power float. It's just a little disc that's spinning around rather than a hand float that I've got to work back and forth, that I'm going to be chewing up gums and gingiva at the same time. So yeah, have to be pretty careful, but I really like the power floats. There's a Dremel set with a variable speed pedal. And then they've got a lot of different ones. There's a lot of different kinds, but they are very effective if they're used in the right way.
Just specialized tools, basically.
Yep. And a couple of things you got to be aware of with these power floats. They can create a lot of heat as well. And so if you ever see me or anybody doing it, we're always moving with that power float. And very rarely do we focus on one tooth for more than just a few seconds, because that heat can cause damage to that tooth root as well.
Just friction from the grinding action.
Yep. And you see a lot of dust flying out of there. I mean, it smells just like when you're at the dentist. It's the same kind of smell, sometimes worse. There's several different kinds of hand floats. This is just a rasp type of a hand float. They can change those as they get dull. A lot of different sizes to work on different parts. This is kind of a metal chip that's a rough surface that will help grind them down. These are some forceps that we'll often use to pull caps with. Horses will be losing caps or baby teeth, often referred to as caps, on those arcades up until about 3.5 to 4 years old. And a lot of times then I'm just going back in there with those forceps and pulling that cap out. That cap is really the root has already disappeared, just like with our kids as we're taking care of them at home as well.
They're already coming out. You're just removing them, so it's easier, smoother transition.
My kids don't let me use these on them, though. I have to use different methods. Neither does my wife. This is just an example of a headstand. I most always use a headstand. If I go back a few pictures, you'll see that I was using a halt. Oh, yeah, you can see it right here. This metal ring that was up on a pulley system. Those often work as well. I have a lot of technicians that will always hold that head up as well. It's hard on them. It's a lot of work. And if that horse ever shakes his head, those metal speculums up against the side of your head do not feel good. They're pretty hard.
Well, and if I understand it right, Dr. Hoops, the horses, they're sedated. So they're going to hang their head, and you get a head on you, and it's a lot of weight hanging there. And so these are just to try and alleviate that on the horse, but get them in a comfortable position for you and the horse to work on their teeth.
Yep. It's really hard for me to work on my knees with their head down on the ground. I have done it, and I'll continue to do it if needed, but a stand right there will definitely be of a lot of value. This is another one of those halters that can be utilized there to keep their head in the air. All right, so let's talk about some of the problems that we're going to see when we get into these horses. There's hooks, there's ramps, there's wave mouth, overbite, missing teeth, broken teeth, and I'm going to show you a lot of these examples. So this is
why we're doing dental work on our horses. This is what you are correcting.
Yep, these are, and not every horse is going to have all of these. Hopefully they don't. That gets into a lot of work and a lot of time. But I have seen horses, and I'll show you some pictures of them here in a minute. But this is a diagram to really talk about the problems, so potential problems. Because our teeth are offset, if our jaw moves back a little at all, then we're going to get an overgrown tooth in the front. And once a little bit of that starts, it gets worse and worse and worse as the teeth wear down. So we're looking at those hooks. I call those hooks on the upper molars in the front there. We can have what we call a wave mouth, where we get high spots and low spots going back through there. We can get ramps in the back. And those back ramps, if you see a hook in the front on the top, you're going to have a ramp in the bottom on the back. And that's where those power tools are really, really beneficial. It's really hard to get clear back in the back of there with a hand float and not tear the mouth up while you're trying to reduce the size of that ramp. We will get overbites. We will get a parent mouth on a lot of horses. That's where the front incisors are not lined up, and you'll often get really long teeth in that front side. And so you'll have to grind them down as well. So those are just some of the problems. Let's look at some teeth now. Let's look at some common problems. Okay, over here on the left, these are the sharp points that will happen on that upper arcade because it's set into the outside. And that is called the buccal side or the cheek side, where we start to see those ulcers or sores begin to form. This will happen in most every horse. This is not abnormal. This is a routine dental care in a horse. And so that is normal wear patterns in a horse. Here on the right is how it's been corrected. Now you notice I didn't go in there and I didn't square that teeth off and make it square. The angle is still there, and that's how you've got to have it. If you square it off, you take away all grinding abilities of that horse. So
it's not flattened, squared off like you're saying. Yeah. It's shorter on the inside to the outside, if I understand you right.
Yeah, and this diagram really shows it here. It's got its sharp points on the outside, and then the buccal side on the inside, or the lingual side on the bottom. You don't come in and square those off. You just round those edges like we see on the right here.
Yeah, but you keep that angle.
You keep that angle. And we evaluate that afterwards. You move the horse's mouth a little bit, and you're able to feel those teeth come into contact and open that mouth up a little bit. That's one of the tests that we do to make sure that the movement is there.
And while you're doing that movement, I'm guessing you're feeling if they're still sticking or where those points are holding or grabbing that tooth, where if you have it rounded off correctly, they're just going to glide real smooth, right?
Yeah. Well, and got to remember, it's still teeth and there's still some friction there, but
friction.
You're feeling for any catches or any restriction of movement. All right. So let's look at some of these problems that we would look at. Okay. And I talked to you a little bit earlier about that swelling on the cheek. And that's what we see here on the right, is that horse has stuffed packed that feed against that tooth because it's sharp and it's pushing the cheek away so it doesn't hurt him as much.
Trying to give it some comfort.
Yep. We also see that hook there in the front. That's a very common finding as well. And they can be, and I'll show you a few more pictures here in a minute. This one on the left is kind of out of focus, but I'm not a very good photographer, but that is a really overgrown first molar, or a 6. That's the 6 numbered. We call that an overgrown 6. And it really prevents that forward to back motion on that horse.
And so then there'd be a ramp on the back end.
More than likely, there's a ramp on the back there in the bottom. And a horse has to be able to go up and down, side to side, and forward to back, kind of a circular grinding motion. And if you take any one of those motions away, you're decreasing that horse's ability to properly digest their food. So this is referred to as quitting, where they'll pack feed against their cheek as kind of a Band-Aid.
Just trying to push it away, give them some relief, get off that sharp tooth, maybe get the abscess away.
Yep, all of those. This is a pretty severe overgrown cheek tooth. And the reason it's formed is because that tooth on the bottom was missing. There was nothing to grind against. This horse was a pretty old horse. It was about done with its life, and it was showing it was really underweight. And so, you know, ideally, if we catch this early enough, we're able to keep that ground down on a routine dental basis so that it's not able to cause problems. My dad has a really nice gelding, uses him, loves him, but we have to do a dental on him every year because he's missing one tooth. Horses are going to bite down on rocks. That's just my opinion, but I think that's the number one reason that horses have a fractured tooth is they bite down on rocks. And after they bite them, they get infected and oftentimes will fall out on their own. As you can see, there's a pretty severe wave mouth. We've also got some ulceration on that cheek side again. And more than likely, this tooth here in the middle is fractured and needs to be removed. Anytime that they're biting down and that tooth wiggles, it hurts. And it's not doing anybody any good in there. And so you would go in and try to remove that fractured tooth. That's not easy. Oftentimes, a tooth removal requires general anesthetic. They lay them down and then they go in and take that out. But that's beyond the scope of what we're talking about today.
Sure.
Regular.
But it's something to be aware of. So
Yeah.
if your vet comes back out or your dentist, whoever's doing it, comes out and says, hey, we got a problem here, it's going to require surgery to remove that tooth. It's not simple as get the pliers.
Yep. That's how it is. This picture really shows those sharp edges that form on that outside there. And this is considered normal routine wear. And we still have sores and ulcers on that cheek. So that's why it's important to be looking at your horse on a routine basis. And I generally say they have an exam yearly. I'm not going to do a dental on a horse every year, but I'm probably not going to go 2 years without doing a dental. But I'll look at these horses and if I see any sores, then we're going right to work on them and taking those sharp points down.
So on that photo there, roughly how long would it take for those to develop from a horse that you got done, floating to now? I mean, it's different for all horses. I understand
it is
that,
different for all horses, but I would imagine this could happen within a year.
Okay.
Yep. That's why we do it on a yearly basis. Not likely going to happen within a year, but it can.
Okay. But we're not looking at 3 months, 6 months. Oh gosh,
No.
I can start seeing sharp points coming in. Kind of idea.
Oftentimes when I'm trying to correct some big problems like a wave mouth or taking a tooth down a lot, I'll have them come back in 3 months to 6 months so I can go a little bit further. I can't correct it all at the same time. If we go too far, we're going to expose a root and make it hurt. Or if it's going to require too much work, just like us going to the dentist, we don't want to sit there for hours with our mouth open. And so we say, go home, come back, and we'll work on it again. Do it in stages.
Yeah. In those extreme cases.
Yeah.
Like
In the extreme cases. Most of the time, no, I'm doing it all.
Yeah.
This is again just another hook forming on the front. This one's not real sharp, but you can see it's going to prevent that front to back movement. Here is a fractured tooth that is then being forced out. And so then it's causing a bigger sore or bigger ulcer in that horse's cheek. This one, I have to tell a story on my dad. My dad raises draft horses in Wyoming, in Star Valley. And he called me one time and he said, this horse is not doing good. He's not driving up. He's not going into the bit. And I said, well, we had just bought the horse too. So he wasn't one that Dad had work on. But Dad was feeding elk up near Jackson. He was living in a cabin with no electricity. And I went up there with the hand floats and I looked and this is what I found. And so I had to take that tooth down by hand. And that was a pain. That was hard. And not just that tooth, but the other side too. And then also a ramp in the back. So I spent quite a few hours working on this horse, but it changed him. He then went into the bit. He got excited and felt a lot better to do his job and really changed the way that horse worked. But as you can imagine, that's long enough that that was cutting down into the bottom gum every time he closed his mouth. It was that bad.
So when you're talking about taking that down, you're not taking like a Dremel tool in there and just sawing it off where you want it. You're taking it from the tip and grinding it down, right? Filing it down by hand, you said in this case, filing it down one rasp at a time to get it to the level point. So if you have a pointer, could you show us roughly where you'd have to grind that down to?
Well, if I was going to grind it, it was going to be right through here. You're taking about 2/3 of that tooth off.
That's a lot.
Now you can do it there because that root system is not going to be clear down in here.
Not like ours, like you said.
No. And on a normal horse tooth, that root would stay up in here. Now, granted, I might do this one in stages, and I did it in stages on my dad's horse, so that it was a lot of work, and it wasn't a lot of fun for either of us to be there doing that. Took a lot of drugs because he wasn't happy with me either.
And a big horse.
And a big horse. He was a big Belgian. There's just another picture of a long tooth in the middle there that's causing a problem. This one formed because there was a missing tooth on the bottom. And so it was not grinding down correctly. We see a lot of teeth like this in geriatric horses, older horses that are losing teeth on the bottom. These are really hard because there we talked about their root, they're done growing teeth. All we can do at this point in time is kind of smooth it out. We're not going to take a lot of tooth off because there's not a lot of tooth there to take, but we're going to we may even pull some teeth at this point to make it a good arcade, so that there's at least something there that they can grind on. This is where you may need to start supplementing your horse with a soft pellet or a soft mash so they don't have to grind.
Give them a little bit of help there.
Yep.
And just as an older horse, the reason for that is the tooth has stopped growing at this point, right? It's no longer continually growing. So you have limited tooth here at this stage. So what age of horse? You might have said it, I might have missed it, but what age are we looking at?
Around 20 to 25 is when that tooth will stop growing. And there again, it's different in all horses. I've seen a lot of 30-year-old horses with really good arcades, and horses that don't have good arcades aren't going to live to 25 to 30. And that's why we see a lot of those problems in those older horses.
So we can't stop when that tooth stops growing, right? No. We can't change that in the horse. That's genetically set. But now, does routine dental work on that horse? Will that extend the life of those teeth a little bit? Well,
this has gone a lot of years with neglect. There hasn't been anybody in this horse's mouth for a lot of years. If they had been doing routine health care, this horse would have a good, healthy mouth that would be able to perform the function that it needs to do. This one is because of neglect. Unfortunately. There again, I just talking about veterinarians and dentists. Dentists have the ability to x-ray, to be able to look for fractured teeth, be able to look for tooth root abscess or anything really, to be able to identify those. And so that's another reason to go to a dentist. There's a lot of different diseases that can happen, anywhere from cancer to abscesses to fractures. The earlier you catch them, the better off your treatment's going to be.
Fantastic.
Anything else? What other questions do we have?
I'm not seeing any questions in the chat box at this point. And I'll just remind our participants, if you do have questions, please bring them forward, either in the chat box or in the Q&A box. If you're on Facebook Live, throw it in the comments section and we'll bring it forward. I think you've covered it really well. And so just kind of a recap. We want an annual inspection. Unless we have more serious problems that have been identified by a vet or a certified dentist. We want to, and the main purpose of that dental work is to have less restriction within the mouth. So we have the proper grinding motion that we can get the best utilization of feed possible that we're giving our horse, so they can extract as many nutrients as possible. And then also to limit any mouth problems, sores, abscess, that kind of thing going forward.
Yep. The other thing too is remember there is a performance component here as well. That if you want your horse performing at their peak, you need to have a dental done on a routine basis.
So when you mention that of the performance, do you see that often, or do you recommend that often? Like if I'm in rodeo, or if I'm in cutting or racing, whatever that performance is, do I want to hit that dental right before the season starts? Not at the end of the season, I guess is what I'm thinking.
I recommend you do it when training starts, not when the season starts. So right now we've got a lot of racehorses getting ready to run in Wyoming. And I definitely encourage them to get those up and moving. So get those dentals done now, rather than not have a good performance, not have a good training session, or they're not utilizing their feed properly. Get them done at the beginning of the training.
Okay. Or before heavy use. I'm thinking of our ranches, right?
Yep.
So this time of year, they're still riding horses, maybe riding pens or check-in, whatever, but it's quieter riding this time of year, not as often in the saddle. Well, this time of year kind of idea?
I don't know with their calving. They're riding those horses out in those pens all the time. So on a ranch, it's going to be what fits your schedule. Just plan a yearly checkup, and a lot of guys want to do that at the same time that they're doing vaccines in the spring, and that works out just well. As hit couple birds with one stone, so you don't have to do it. And as well as the deworming, what we'll talk about here in just a minute.
Yep, perfect. The last question I have.
Yep.
What if I have the pasture pet? What if I have the babysitter that never gets used, never performance horse? Is that different dental wise with that animal than one that is performance?
If we want to prevent this kind of a mouth, then yes. If you want that horse for a lot of years, then you've got to make sure that those teeth are taken care of so we don't get this kind of a problem. They'll still get the fractures. They'll still have those kind of problems. However, they're not utilizing as much feed as a performance horse. The nutritional side of things is not as vital at that point in time. But if you want, this horse that we're seeing here was a 22-year-old horse that hadn't seen a dentist its entire life. And this, now we're behind the ball so far that it was really hard to get this horse back to a condition that it was comfortable. It was so far underweight. You can't ignore them. You've got to be able to look at it. And you're not going to see this from the outside. You're not going to see it. This horse covered up the problems for a lot of years, and then all of a sudden went downhill within a 6-month period. And the owners brought him in, and I said, yeah, we should have been doing this a long time ago.
What about wild horses? Same problem, same issues in wild horses. There's a lot of wild horse adoptions and things like that, which is great, but same situation?
Yep. And wild horses, old horse out in the wild is between 10 and 15 years. This is one of those reasons why, is because they start to see some dental problems and they aren't able to get the nutrition that they need.
Right. Perfect. Well, I think that wraps that one up. Let's switch gears and jump over to internal parasites and control of those. And yeah, I'll just keep watching the box here. Okay. Not seeing any questions jump in, but please send your questions forward if you do have any on either presentation.
Okay, so let's talk about internal parasites. And this one's going to be a little bit shorter of a one. And we have some cool pictures. It's kind of fun to look at. I don't know.
For a vet. We need to clarify that. Cool for a vet. It might be a little squingy or squeamish for some of us.
That's all right. But we'll talk about a lot of the different kinds. We see a lot of large and small strongyles, roundworms, tapeworms, lungworms, pinworms, and bots. Now, there are more, but these are the common parasites that we see in our horses.
Hold on, Dr. Hoops. Yep. I had a question just come in, and I think it relates to the teeth before we get into internal. So let's answer it now. The question came in on Facebook. Really appreciate it. I've heard too many apples and carrots can cause issues. Is that true, or can I keep being liberal with the treats?
It doesn't seem to cause problems like we see it. And you may be thinking about cavities. We don't see a lot of cavities in horses. It's because of that natural grinding. If there's a cavity, within a year, it's going to be gone anyway because it's grinding that tooth down. I don't have a problem feeding apples and carrots. Those are generally pretty good treats. But you know, there's a lot of behavior things than feeding treats, but dental wise, I don't have a problem feeding those. I don't think they're going to cause problems.
Don't feed your horse rocks.
Yeah, don't feed
right. And part of that, I think what I'm going with that is maybe that's a reason why not to feed on the bare ground, especially if they're in a dry lot situation.
Well, there again, and I didn't cover it, but let's talk about it for a minute. If we're feeding the horses high in a feeder, their teeth are going to be in a different position. If we're feeding them down on the ground where that's normal, then that's a better wear on their teeth. But then again, we've got the problems, and we'll talk about it with worms as well. Feeding out on the ground, they're susceptible to eating dirt, rocks, and getting worms. So what I tell people, I like them fed on the ground, but I like them fed in a feeder that has a bottom. So it's a bottom that's on the ground so that they're not picking up those other problems.
Right. And then if you're like my horses, I feed them in a tub like that, and then they throw it out on the ground anyway.
Horses are going to eat rocks no matter what. So,
right. Can't stop that.
If there's a rock there, they'll find it. So.
Yeah. Good. I think we're good. She said, thank you so much. Excellent. Appreciate the response. So
okay.
We're now good to move on with internal parasites.
There's our pictures here. All right. So this is very typical, large strongyles. These are the ones that you'll often see come out in their feces. They look like a bean sprout or something like that, but they're often moving. Clinical signs would be weight loss. They're anemic because horses, they're going to be taking the blood out of that system as well. Weakness, emaciation, diarrhea, colic. These are some things that will cause colic. Your basic ivermectins, most of our medicines are going to take care of these large strongyles.
Are you going to see those in the feces?
You often will. You often will see them in the feces. These small strongyles, you don't often see because they're so small. Generally, these you'll see on a necropsy or something like that. Generally, they don't have a lot. You'll see some weight loss. You may see some enteritis or infection of the GI system, but these are going to be not real visible to the naked eye. And there again, your daily treatments, we'll get into those here in a minute, but your regular deworming is going to take care of that as well. These roundworms are often what we'll see in surgery. This picture was taken of a 6-month-old foal that had never been dewormed. It started to colic, went into surgery, and this is what they found. These roundworms, these are big. They're often the reason why that foal is malnourished as well, because these worms are taking all the feed that baby eats. And so you'll see a coughing, hair coat, a pop belly. You're feeding them all they get, but they're just not looking good. It's often due to these worms. Okay.
But at 6 months old, I mean, you would never guess that, right? Like,
you need to start worming your foals early. I've got a slide with that here in a minute. But you have got to hit those babies on a routine, regular basis. Our older horses can get away with it. Obviously, you want to take care of them as well. But these babies on a 6-month-old foal can have this kind of a problem. It's not pretty when they do. Tapeworms. We're beginning to see a lot more tapeworms. Used to be a common belief that in the Intermountain West, there were no tapeworms. That's not true. They are here.
What's changed? Or
I don't know that anything's changed. It's just now we're finding them. Better diagnostics.
Okay.
So yeah, we see anemic. They're weak, emaciated. We don't see a lot of them, but I do think it's important that we do know tapeworms are here. Lungworms, they cause a cough. They'll cough them up and then they swallow them and it's kicked out through the feces. These are, we don't see a lot of these, but they are out there. You won't see these in the feces. They're too small. Have to have a microscope to see them.
And coughing them up through their lungs, then through the stomach. That's part of the life cycle of that
Yep.
one, if I understand it correctly.
Yep, it is.
Yeah.
These we do see a lot of, these pinworms. And what they like to do is crawl out the anus of that horse, and that causes a lot of itching. And so that horse will go rub their tail. And so we do see a lot of these pinworms.
And you'll just see that, especially that picture on the right, to me, like that
Yep.
tail head is just rubbed off, basically.
Yep.
All the hairs are broke off and from the
Yep.
excessive rubbing.
Yep. Now we got to be careful too, because they'll also rub if they've got a little bit of allergy going on or itchy skin. And so hit them with dewormer, and if it doesn't fix it, then you know there's some allergy there, and you got to do some topical medications for that. We do see a lot of bots. These are very common. These are the ones where that fly will lay that egg on that horse's leg. The horse will then reach down and lick it and bring that bot into their system. That larva will live in their stomach and cause a lot of ulcers. And so then that we want to get rid of those bots. This is one that you'll see in the fall of the year. And I always tell people, wait until after that first hard freeze, because that hard freeze hits and it kills all of the adult flies that are out flying around. Then you can deworm them and it gets rid of everything all at once. If you deworm them in September, that fly is still around and they're still going to have an infestation. And so this is one of the major things that we see.
So when you say a hard frost or hard freeze,
Yep.
Is there a temperature that you consider or a duration of that cold before it's considered, hey, it's done?
No, and you'll generally have a few hard freezes in a row. I mean, if it just gets down and you see a little bit, it's not a hard frost. I consider a hard frost down to 25 to 20 degrees, and you see a hard frost on your windshield.
Yeah.
That's what I consider a hard frost, and that's going to kill those flies.
Perfect. Well, and I guess that's what I was trying to get to, is just because we hit 32 degrees, we freeze,
Yeah.
right? It's not enough to totally kill those flies. At least for me, it's observation. The flies are there and they're not the next day kind of thing. And I look for them, and correct me if I'm wrong, I look for them kind of in the warmer part of the day.
Yes.
To see if they're active, because when it's cold, they'll get back in the cracks and crevices of structures, barns, buildings, whatever, to try and stay warm and survive that frost. Is that correct?
Yes, that is correct. And you can also see these bot eggs, they need to be ingested rather quickly for them to be a complete life cycle. But you can see these bot eggs stay on these horses' legs for several months. That if we knew what glue those flies were using, it would be amazing. It's hard to get them off. It is hard.
Now, it's not necessary to get it off, correct?
No, I am not a believer that you can decrease a bot infestation by trying to comb those off. We're not going to be out there every second of the day. And as soon as that fly lays an egg, we're not going to get it off. These horses are going to be infected with bots. And so I just figure, yes, we're going to treat every horse after that hard frost to get rid of these.
So that bot lives in the intestines,
lives in the stomach,
and then it comes out with the feces. It goes through a molt, right, and comes into an adult fly, which then lands and lays the egg on the horse's legs or chest area, and then the cycle works over again. Yep,
that's how it works. Okay, now there's a lot of different classes of anthemetics or dewormer that we're going to use. The ivermectins have really revolutionized our deworming process and have made it really, they get a lot more of these bugs. They're pretty broad spectrum. They cover about everything. The only thing that I say, that doesn't hit our tapeworms. And so we have to use a mixture. One thing I like to do, we have a lot of resistance building up. And so we have to be careful. I like to say, let's rotate our dewormers, and then let's but make sure we're doing it on a regular basis, our rotation.
And
So-
just for clarification for all our viewers, resistance is resistance of our pests, these worms, the bots, to the active ingredient in our wormers.
Yep.
The chemical like ivermectin or the other chemicals listed here, they become resistant to that. So the chemical doesn't control them as effectively, does not have as good of kill or control of those animals or of those pests, excuse me. And so by rotating that, we need to change that up so they don't build resistance.
Exactly.
And I think you'll talk a little bit more about that, of what you're seeing, how you like to see that rotation.
Yep. Okay, so we look at what are the goals of our control program. We want to minimize the risk of parasitic disease. We want that horse to be able to live without them. We want to control our parasite egg shedding. We want to interrupt that life cycle. And we want to maintain the efficacious drugs and avoid further development of resistance. That's what we just talked about. So the idea is to keep the number of treatments at a minimum so that we're not building up resistance. So there's a couple of different ways that you can do it. In the past, and I still like it, I have a hard time where they say, don't do it on a regular schedule. Well, we do. When we're talking about a first hard freeze and then going after that, that's on a schedule. But we are also treating for specific reasons. If one horse has these parasites in a group, then all of them are going to have these parasites in a group. So we're going to group treat. The best way to do it, and what is recommended, is you have a professional do a fecal egg count and then treat according to what they're seeing in the feces. That's a good way to do it. As a professional, I'm going to tell you, every horse in the fall is going to have bots. And so we're going to treat after that first hard freeze, not doing a fecal egg count, because the area that we live in, we have these flies. And you
don't have to count, they're here.
Exactly.
Yeah.
But a lot of different strategies. Okay, we go out, we pick some feces, we pool the feces, then we do a fecal egg count and really see what the entire herd is looking like. Then we treat the entire herd according to that egg count. There's a lot of different ways to do it. And what I like to look at, we're using a lot of ivermectin. I use that ivermectin twice a year. I will combine it with a praziquantel at least once of those years. Then I'm rotating and go with a moxidectin or a fenbendazole twice a year. So I'm routinely doing it, and 4 times a year is essentially what I'm doing, it quarterly. I like to make sure one of them is after that first hard frost, and I'll use that ivermectin at that point in time. Then in the spring of the year, we see a lot of a heavy parasitic load coming up with those first shoots of grass. And so I like to wait a few weeks after that and hit them then, so that we're doing a good job. Those are the only routine ones that I do. Other than that, you look at that horse, you look at your program, and you treat according to that. And a lot of people will oftentimes do it on a yearly basis, or not yearly, a daily basis with the Strongid C. Let me show you that. Right there, Strongid C. And that's meant to do on a daily basis. And those are your performance horses, those horses that have insurance, those kind of things. I'll get back here because I got to talk about these foals. Regular every 60 days. You've got to do your foals at least every 60 days, if not sooner. They're getting infested. They don't have any natural immunity to it, and they're going to be really affected by it. So that's what I'm talking about, is those foals. I like to start right at, 6 weeks old on those babies. And you do it according to their weight. So you've got to guesstimate their weight and give them the proper amount. But you've got to do it on a routine basis so that we avoid those colicky problems that we're talking about. Also, those foals need all the nutritional value they can get. They can't afford to be given half of it away to those worms.
Perfect. So I always hear this, and I'm sure you probably hear it more than I do, but on colic, is there any data or any research that shows that deworming can cause, if there was a high load of worms in there and I dewormed, that ball of worms can cause a colic?
It is a problem. And if you suspect a real heavy load, make sure you're talking with your veterinarian in that process. You don't want that to happen, because you can have a massive kill off that will send it through and cause a colic episode. And so you've got to consult with your veterinarian on what to use and how much to be using.
And if I understand it right, that's the benefit of floating and getting that egg count.
Yeah.
You can kind of have an idea how heavy the load is and the potential risk of that, right?
Yep. It's exactly right. That fecal egg count, and doing that with a professional. Some other suggestions: avoid overstocking or overgrazing pastures. Rotate what you're using in your product so we decrease that resistance. Keep the pasture mowed down. That prevents a lot of that infestation as well. Let the sun get down there and kill some of those eggs. Harrow or rake the pasture so you're breaking up those manure clods, and that also decreases, lets the sun do the work that you're doing it. Cross graze it with cattle or sheep or goats. Rotate it, because your horse worms are not, or horse parasites are not going to cause problems in your cattle, and vice versa. So you're giving rest to that pasture from a specific contamination. Also get a cutting off of it. Leave the animals off that pasture for a given period of time and break that cycle that is occurring.
So a question on that is there a difference in the worm load, so to speak, between an irrigated field versus rangeland or a dry pasture?
A dry pasture will not have as much. And that's because the life cycle. So they do require some, but it depends on the, and I'm not an expert in parasitology. There are some that do need a dry area versus a wet area. So it depends on the specific bug.
But just because my horse is out to rangeland, Wyoming, it still can have worms. It still can be a problem. It's not only found in moist or wet states or in wet pastures
or lush green pasture. No, it's not just a problem there.
Yeah. Okay.
Feed there again. We talked about it already. Feed in a container that has a covering so that's not directly off the ground. Remove the manure from the stalls, paddocks, and the pasture within a 24-hour period. Your water source, make sure it's clean and not contaminated. If you get new horses, and we could have a whole talk about biosecurity, this is one of those reasons for biosecurity, is that you're not contaminating the rest of the herd with whatever you're bringing in. And after you do a fecal exam, a fecal float on that horse. Compost your manure. That process kills most of your parasitic eggs, that composting process.
Now, when you say composting process, we need to get the heat in a true compost for a set amount of days to actually do the damage. Not just putting it in a pile does not count. We have to have the heat.
You got to mix it, get the oxygen in there. You've got to do a true composting procedure to actually kill those eggs.
Perfect.
Yeah, if you're just piling it and then you go spread it around the field or in your garden, you're going to grow all kinds of stuff. Yeah. These are just some popular, or they work really good. I'm not trying to promote any specific brand or anything like that. These are the things that are on the market that work really, really good. So,
but you look on the label of the box, right? And it'll tell you ivermectin. That's the active ingredient in that wormer that's doing the control.
And they found that 1.87% is all it needs. And that's a good one. That's a good, it has a good kill. Your pyrantel palmoates, there's a lot of them. We use the Strongid when we're deworming cats and dogs as well. It kills some of their bugs as well. These are pretty good. They all work really good at the right time and the right place. I use moxidectin on my rotation schedule. I think it works really well. There again, remember, I'm looking at the active ingredient, not necessarily the person that's making it.
Yep, the brand name or generic name. Yep.
I look at the active ingredient. Fenbendazole is really good as well. We use that in horses. There again, Strongyl C, that's the daily, and that's a pellet where they're giving a scoop every day. And a lot of times these guys have a claim that they'll prevent any colic and pay for any colic surgery. Yeah, that's a claim they make, and sometimes it works, sometimes it doesn't.
But that's in a performance horse. This is not generally your backyard horse type medication in terms of price, I'm suspecting.
Yep, that's true. Zimectin Gold, this is a popular one that works really well. It's that combination of the praziquantel. Yep. I use this one on my fall rotation. And amoxidectin praziquantel, that really works well too. There we go.
Wow. Well, if you want to stop share on that, Dr. Hoops, I really appreciate it. I'm going to double check everything here. If you got a quick question, shoot it in here before we wrap it up. That was fantastic. Internal parasites was a lot shorter, right?
Yeah.
But one thing we did not say is probably just read the label and apply according to the label. Right?
And consult your veterinarian. Make sure you involve them in all aspects of this, your control. Doesn't mean they have to be the one administering it, but talk to them about a schedule for your area and what they're seeing. Yep,
definitely consult your vet. It doesn't mean you even have to buy it through your vet, right? You can buy it off the shelf at a lot of stores, but just consult them on what the schedule should be, the different types of actions they should see, the timing. I think you gave us some great ideas on timing. One thought I had. So this, I have to open the can of worms. Sorry for the pun, but this really jumps in my thought of people that are boarding horses, right? Like what a challenge that is or can be, right? Because you don't always have control of the herd, so to speak, right? You have control of one or a few individuals that are yours at somebody else's place. You're traveling a lot. Manure management's a challenge, maybe, right? And we don't know what all the other horses are doing. Can you speak to that realm of situation?
If you're in a group housing, I think you have a right to say, hey, everybody in this group, and I do when I'm consulting boarding facilities, they set the rules and say, if you're going to board here, I recommend you have all of these vaccines, you deworm at this schedule. This is what works for us. And most people boarding there are going to do it. However, if you don't have that capability or don't have that ability to regulate everybody around you, then you get on your schedule with your veterinarian and you can do what you need to with your horse. And it can be taken care of.
And that is a shopping point, right? If you are looking for horse boarding, sometimes it's short. We don't have many choices. But talk to them, consult them. What is their schedule? Do they have a schedule? Do they encourage it? Whatever. But it ultimately is on your responsibility. Protect yourself, right? So fantastic. Awesome. Well, I appreciate it, Dr. Hoops. This was fantastic. Couple things. One thing I failed to mention while we were doing the equine dentistry, Dr. Hoops wrote an article on equine dentistry for the Barnyards and Backyards magazine. That will be coming out in a couple months for the spring edition. We really appreciate that. It's going to highlight what we talked about here as well. When we get that, we'll post it up on the website with this. So we're just going to wrap this up. Jenny, if you want to throw up our photos there. So with the Barnyards and Backyards, what we do with this is we record all these shows and then we post them back on the Barnyards and Backyards website under the Barnyards and Backyards live tab there. And under there, you will see all the episodes coming up for next time periods and what those schedules are and what the topics are. But you can also look back on shows such as this one. Watch the recording. We post up any links or any reference materials that were talked about during that. We also have archived ones from the past 2 or 3 years. I can't remember how long we've been doing this now. So watch those as well. We keep those up there for your benefit. They're not a one and done type thing. So please dive in there, share them with people that didn't make it or anything that way. The other thing, if you got questions, reach out to your local extension office. We got an office in every county and one on the Wind River Indian Reservation. That was a hard one for me tonight. but we have an office out there. So reach out to us. We can connect you with folks down on campus, our equine specialists down on campus. We can even get you in contact with Dr. Hoops at Utah State University. So really appreciate that. The last thing we have for you is an evaluation. Yes, you joined an extension event, so we have to evaluate it, right? This is our chance to get feedback from you of how we're doing with the show, if there's topics that we're missing that you want to hear. So please take a chance. Jenny has thrown that in the chat box and into the Facebook Live comment section there. Just click that link. It's a really quick survey. We really appreciate the feedback. With that, Dr. Hoops, I can't thank you enough for spending some time with us, sharing that knowledge. Thank you so much.
Well, thank you. I sure appreciate it. It was a good evening.
All right. You guys take care. Have a good night.